Hi guys, my name is Cindy Medina and I will be talking about Down syndrome. So, what is Down syndrome? So, another name for Down syndrome is trisomy 21, which is caused by the presence of all or part of a third copy of chromosome 21. And there are three types of Down syndrome, which is trisomy 21, mosaicism, and translocation. So the types of syndromes, like I said, there are three types of syndromes of Down syndromes, which the first one would be trisomy 21, which is the most common one, where every cell in the body has three copies of chromosome 21 instead of two. And for translocation Down syndrome, each cell has a part of an extra chromosome 21 or an entirely extra one, but it is attached to another chromosome instead of it being by its own. Now, for mosaic Down syndrome, rare type where only some cells have an extra chromosome 21. Can Down syndrome be identified before giving birth? And yes, it can be detected during pregnancy. And the way it's done is by doing a prenatal screening followed by diagnostic testing or after by directed observation or a genetic testing. But sadly, there are no cures for Down syndrome. Now, symptoms and signs regarding Down syndrome. There is mental impairment, stunted growth, slow cognition, short neck, abnormal teeth, as well as narrow roof of mouth and delayed growth. Now, for parents that do have a child that has Down syndrome, make sure to have your child play with other kids who do and do not have Down syndrome, which this also helps them expand more. And keep your expectations high as your child tries to learn new things, and support your child in doing day-to-day tasks on their own. As you may know, parents that have a child that has Down syndrome, they do end up struggling a lot depending on what type of doctors they go to or even themselves, but one must know that you're not alone. There are different programs that you can look for that may help the parent grow, as well discover communities in which there a lot of parents are going through the same thing. And you can always ask your healthcare provider about early intervention programs and make sure to always participate in school and leisure activities as well. Now, education, when it comes to education, there are some children with Down syndrome that are able to take typical school classes, while others require more specialized education. And some are able to graduate from high school, and some others go to secondary school. And there are different other programs in school that can help a child with Down syndrome. Now, some of the risks for Down syndromes would be individuals having a risk of developing several medical conditions, including gas, gastroesophageal reflux, which is the backbone of acidic stomach contents into the esophagus. Down syndrome has an increased risk of hearing and vision problems, as well as 50% of people that have Down syndrome have an underactive thyroid gland problem. And a small percent of children with Down syndrome develop cancer or blood forming cells, also known as leukemia. Now, is Down syndrome inherited? Inherited? When the condition is caused by trisomy 21, the chromosomal abnormality occurs in a random event during the formation of a reproductive cell in a parent. But people with translocation Down syndrome can inherit the condition from an unaffected parent. When it comes to mosaic Down syndrome, it is not inherited, but it does occur in a random event during the cell division early in the fetal development. Now, some of the complications um, that one with Down syndrome experiences heart defects, as well as immune disorders, sleep apnea, obesity, dementia, dental problems, as well as leukemia and seizures. Now, this is all about teamwork. Making an important decision about your child's treatment and education starts with a team of healthcare providers, teachers, and therapists that you can trust. Depending on the child's, particular need, here are some maybe specialists that may be able to help. For example, a pediatric cardiologist, as well as a primary care pediatrician to coordinate and provide routine childhood care, developmental pediatrician, as well as a pediatric eye doctor, and a speech pathologist, as well as a physical therapist.